Canadians are entering the 13th month of government restrictions that are managing and dictating every aspect of our lives. The 13th month of daily and ongoing violations of our human rights and fundamental freedoms. In just 1 year, government orders have forced stores deemed non-essential to close, shut down restaurants for months at a time, as well as museums and libraries, closed schools and universities for in-person learning, canceled cultural activities, thrown a pastor in jail for over 30 days for holding Sunday church service, and outright banned faith groups from in-person worship because the government has decided religion is a non-essential activity. Governments across Canada are preventing Christians from worshiping together in person as they have for over 2,000 years. Church in the new Canada is illegal. Health orders now forbid visitors to your own private home. Family dinners on important holidays have been outlawed. Young children who have a greater chance of being hit by lightning than of dying of COVID are being forced to wear a mask all day just to attend school, even outside at recess and during gym class. A generation of children are now being taught they cannot sit with their friends from another classroom at lunch, that they must live in fear, that singing and laughing can spread deadly germs and kill grandma and grandpa. Depending on the province, it is forbidden to spend time with friends, to work out at the gym, to be with an aging sick parent, to go out for dinner, to play a game of hockey on an outdoor rink, to leave the house after 8 p.m., or to leave the house at all, unless it is considered essential by the government, to buy food, pick up prescriptions, buy marijuana, or go to work. Many provinces have health orders that state people must work from home. Fines of over $1,000 have been issued in every province in Canada for going to church, for not covering their face, and for people assembling peacefully to protest the government lockdowns.
Any casual observer of the corporate media over the last week will have noticed that Canada is not faring well on the COVID front line. Apparently, cases are skyrocketing in provinces like Ontario and British Columbia, and health authorities are enforcing strict lockdown measures again and upping penalties for rule breakers. Though they won't admit it, this seems like an admission that what they've been doing isn't working. Also, we found out that Canada's death rate in long-term care homes due to COVID is the highest among first world nations.
For 13 long, unbearable months, Canadians have lived day to day under stress and uncertainty, with the government threatening them to not see their family and friends, forced to communicate by phone, email, and Zoom. When questioned, our government leaders insist these measures are based on science, and they are trying to save us all from dying. Canadians, 90% of whom are not at significant risk from COVID, have lost all of their sports, entertainment, and recreational, spiritual, and cultural activities. Simple things like hugs, swimming, skating, barbecues with the neighbors, going to movies, playing hockey and basketball, having birthday parties, even sitting on an empty park bench, have resulted in fines of thousands of dollars under COVID public health orders. Canadians have been told how many people can attend a wedding and funeral. All of these restrictions and quarantines of healthy people, we are told by politicians and public health officials, are to protect the country. The government's own data shows that the violation of all of the charter freedoms to move, travel, gather, assemble, associate, worship, and express are to try and stop a virus that kills sick and elderly people, 80% or more of whom are in nursing homes, more than 80% of whom are over 80 years old. The young and healthy are being restricted in their movements and activities, forced to abide by curfews, forced to give up any social life and group activities, and told to do the right thing and stay in their homes.
I can understand some people are looking for constitutional conversations. I'm not going to engage in those right now. I am focused on getting us through this pandemic.
Easter's just around the corner, and as I've said, that the epidemic may be resurging.
Comprehensive strategy since the very beginning of this epidemic and pandemic.
As we all know, it's been more than a year since the start of the pandemic, and our lives have been put on pause, leading to many in power calling to follow the science. Just listen to us. We're going to follow the science.
And we're using science to help make it happen. Because when science wins, we all win.
There have been differing views. differing views among public health officials, amongst the medical community, amongst policymakers, and of course the public. No jurisdiction is perfect, and we are certainly no exception. But our job in such an unprecedented crisis as this one is to make the best decisions we can with the best available information, and that we have done.
Gyms and hair salons or barber shops, they're not going to be allowed to open under gray. And I just want you to explain to those business owners who have spent a ton of money fixing their shops, changing their shops and gyms to make them safer. What data are you using? Because I don't think we've heard this through the whole pandemic, to say you can't reopen even with all the safety measures that you put in place. What data are we relying on for that decision?
Those are questions that really should be best directed towards the province.
You keep saying that you've got to get the green light from doctors, but where does the leadership of a politician come in, whether it's dealing with Dr. Williams or telling someone like Dr. Davila, who quite frankly I think would keep us locked down for months to come?
I take my information through Dr. Williams, Chief Medical Officer. I'm going to be very frank. There's no politician in this country that's going to disagree with their Chief Medical Officer. They just aren't going to do it. They might as well throw a rope around their neck and jump off a bridge. They're done. I'm telling you the facts. It's very simple.
I don't know why I bring all these papers and never look at them.
Well, when you're giving numbers, I do. I go, oh. I think, did you really do that?
I just say whatever they write down for me.
That's why I look at things.
And as Premier, it falls on me. I'm the one who has to make the tough decisions.
Yes, hi. I'm asking a question today about the varying numbers of crowd sizes that have been applied across provinces in Canada. We're getting questions about it. Why is it 5 in Ontario and 50 here?
Yeah, so we also had that discussion on our Special Advisory Committee call on Sunday across the country. And, you know, it really is about, right now, all gatherings are off the table. So when I talk about 50, that's for mass gatherings, for events, for things that are happening in the community. And I am reticent to go. None of these are based on scientific evidence. There's some evidence in that some modeling that Alberta has done that shows that 18, if you have less than 18, your probability of having a case may be less, and so they went with 15. But the bottom line is, none of this really is based on science.
The 6-foot distancing requirement has probably been the single costliest mitigation tactic that we've employed as a result of COVID, in response to COVID. And it really wasn't based on clear science.
Last year, one of the top aerosol scientists in Australia, a woman called Lydia Maraska, likened social distancing regulations to a cult ritual. Quote, "The dogma was born. Like any dogma, it's extremely difficult to change people's minds and change the dogmas." So dogma posing as science.
Go out, wear a mask, stay 6 feet away from anyone. When you're outside, stay at least 6 feet apart from someone. I think if you stay 6 feet apart with masks, you can do whatever it is that you need to do.
In the state of Washington, high schools tried their best to comply with Anthony Fauci's pronouncements. Here's how one school adapted its band practice to conform to German germ research from the 1890s.
Wenatchee High School finding a socially distanced solution to get the band back together.
Getting less oxygen is good for you, so get inside your little plastic pod like freeze-dried people. It's dystopian. It's not great. It's horrifying. But the kids had no choice. The science was settled. That's what we were told. Well, it was settled until last Wednesday, when the Journal of Clinical Infectious Diseases found that the law of 6-foot social distancing isn't actually real. It's not a law. It was a guess, and it's wrong.
There's this new study from researchers in Massachusetts, just out this week. It found no significant difference in coronavirus spreading in schools where there was 6 feet of distancing versus 3 feet of distancing. But that 6-foot requirement, that's one of the main hurdles to reopening schools.
Right.
Does this study suggest to you that 3 feet is good enough?
It does indeed.
We'll just move forward with the new science.
and they have said, we've looked at the science and we've looked at the recommendations, and the kids in the class don't have to be 6 feet apart. They can just be 3 feet apart, and that's absolutely safe.
And that's fine, because science is designed to answer questions to which you don't know the answer. The problem is when the people in charge of our public health systems won't admit that they don't know. So all of this should prompt some pretty tough questions for our public health experts in this country. And one of those questions is, how effective is this coronavirus vaccine? How necessary is it to take the vaccine? Don't dismiss those questions from anti-vaxxers. Don't kick people off social media for asking them. Answer the questions.
If you're not infected, you can't transmit it because you don't have the virus. But what we don't yet know is whether the vaccine prevents you from being infected. So being infected means the virus is in your body and you may not be showing symptoms.
And we need to make it clear to them that the vaccine is the ticket back to pre-pandemic life. And the window to do that is really narrowing. I mean, you were mentioning, Chris, about how all these states are reopening. They're reopening at 100%. And we have a very narrow window to tie reopening policy to vaccination status. Because otherwise, if everything is reopened, then what's the carrot going to be?
Yeah, and what I worry about is we're going to move to this not just in schools, but our population is going to move to segregation. I worry that the administration is moving towards these vaccination passports, where they're going to have to reveal personal medical information, and you're going to have people who have rights and can do things, and others that won't be able to do things. They're going to start doing this in sporting events, and they're going to do this, and they're going to start pushing this country further and further apart. But this is part of the playbook.
Just a year ago, most Americans understood that social distancing was a form of punishment. It's not good for man to be alone, and we've lived accordingly. Apart from the death penalty, the harshest things we do to criminals in this country include separating them from other people. Prisoners have chosen lethal injection over solitary confinement. That's how badly human beings need to be close to one another. So when they told us to stay far apart from each other last spring in the name of public health, it was an enormous sacrifice. But because this was a trusting and law-abiding country, we obeyed that order. We barely grumbled about it. We assumed they knew best. 6 feet from each other. That was social distancing. It was the law, and most of us followed that law. But where did that law come from? Who did the scientific research that determined 6 feet was the safest distance apart from other people that you could be? It turns out the research that formed the basis of that law came from a German hygienicist called Karl Pflug. It was Pflug who decided that 6-foot separations were necessary to slow the spread of pathogens. The CDC went with Pflug's judgment. What the CDC didn't tell us was that Karl Pflug had been dead for 100 years.
Never before in history have millions of Canadians who are not sick been told to give up all of their freedoms and social connections with other human beings for months at a time to save the life of people with 3 or more serious health conditions like cancer, heart disease, and emphysema. Politicians have refused to provide evidence that these lockdown measures have done more harm than good. Public health officials have presented plenty of scary, and as it turns out, wildly inaccurate models predicting tens of thousands of deaths from COVID. These predictions were demonstrably false.